Welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. Ron will not be with us today. I'm Lita.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX. On today's show, we are speaking with Dr. Alexander Zubkov. And Dr. Zubkov is a leading functional medicine expert in Minneapolis. He is committed to changing the lives of people with chronic health issues, like all of us, and he believes in a comprehensive approach and creates tailored treatment plans that consider both physical and mental health, which is very important, leading to a well-rounded path to wellness. His focus on treating the underlying causes of health problems, not just the symptoms, distinguishes him in functional medicine. His practice includes a variety of strategies, such as environmental changes, lifestyle improvements, individualized nutrition, hormone balancing, and peptide therapies. He aims for overall health enhancement, and he values the mental and emotional aspects of healing as much as the physical ones. Well, I think that's a great intro, sir, and we're going to go ahead and start.
Thank you so much for having me.
You're welcome.
Yeah, thank you for joining us. Dr. Zubkov, I want to start by asking what led you to a career in medicine and neurology in particular?
So I'm from Russia originally, and in Russia, typically we go to medical school immediately after high school.
Okay.
So during the last 2 years of our high school, or our school rather, we have a so-called professional orientation. So we can choose to try a career path that we would like to see. And I chose to be a nursing assistant. And that involved basically going to the hospital, taking care of the patients. And that's kind of how I got in love with that. But for neurology, it was just very natural to me. I kind of felt that this is what I want to do. I want to figure out where that lesion is, how to treat the patients. And that was exciting to me. That was actually easy to me comparing to all my classmates. They were looking at me like, how do you get all this topical diagnosis right away and we cannot figure it out? And I don't know, it just came natural to me. So I had fun.
Oh, well, that's great.
Perfect.
Yeah.
Well, they do say that if you enjoy your job, it's the best thing in the world. So I'm glad that you found your niche.
100%.
And why did you choose to immigrate to the United States? We're happy that you're here, by the way.
Thank you. That was a long time ago, over 30 years. And at that time, I was finishing up my residency in Russia, and I just needed to get a continuous education. So I moved to University of Mississippi at that time, did my PhD, did my residency. Life happened, so I was not able to come back. And then I moved to Mayo Clinic to do my fellowships in stroke and neurocritical care. And that's how I ended up in Minnesota.
Oh, okay.
Okay. Well, that explains that.
So
Yeah.
I absolutely enjoy the weather here, and I absolutely love the nature here. So this is my home now.
Oh, wonderful.
Okay.
We have been...
We've been there a couple of times.
Yes.
Yeah, we love Mayo. And the little mole city underneath.
I call it a mole city. It's hard to explain to Chicagoans how unique it is to have tunnels underground.
So you don't have to go outside.
Where you have like shopping and a library and the grocery store and restaurants underground. So that, you're not going outside in a blizzard, which is fantastic.
That's absolutely correct.
And could you explain to our listeners what is integrative neurology?
So basically, a regular neurologist, when you come to a regular neurologist, we will do all the diagnostic, we'll use all the diagnostic tools, we'll examine you, we'll give you a diagnosis. And then the only thing that neurologists can do is to get you either to physical therapy, give you some medications to help you, or if you have a surgical issue, they will get you to neurosurgeon. That's kind of the limitation. But very early in my life, as a stroke neurologist, I was expecting to see very old people. And when I started my career as a stroke neurologist, I started seeing 30-year-olds with the strokes. And I very rapidly realized that those 30-year-olds had the same risk factors, obesity, high blood pressure, diabetes, as my older patients.
Mm-hmm.
Well, if I'll give an aspirin or medications for stroke prevention in the older patients, I may actually help them for another 10, 20 years until their natural outcome. But in a 30-year-old, giving medications for 50 years or 60 years probably will not be very effective.
Mm-hmm.
That's how I got into more nutrition initially, the diet. At that time, paleo diet was all the rage. So I got into paleo diet and started seeing significant improvement in patients' overall health, in overall fatigue, and really blood markers.
Mm-hmm.
And started studying integrative medicine in a much deeper way, took multiple courses, multiple classes, and that's how I started, and been doing it for the last 15 years.
Okay, so instead of just saying, yeah, here's the pill, you're saying here are the lifestyle changes that
Exactly.
will make
We can create everything.
right,
We
yeah,
can-
improve your overall quality of life.
Mhm.
That's wonderful. And how
Exactly.
might treatment protocols for a patient with like cognitive decline, for example, vary between an integrative approach and a more traditional neurology approach? I know you
Sure.
kind of said it's more than just taking a pill.
Oh, absolutely. So before diving into that,
Mhm.
let's kind of step back and say that not every patient with memory problem have dementia.
Okay.
Obviously, this is the most scary part.
Hmm.
But as a neurologist, even as a regular neurologist, we always look for reversible causes of memory loss.
Mhm.
And that may be thyroid dysfunction, it may be vitamin deficiencies, it may be sleep apnea, it may be other things that potentially will cause memory loss.
Mhm.
And if we correct that, then all of a sudden patients will get better and their memory come back.
Okay.
In rare patients, unfortunately, they do have frank dementias. And dementias, when patients develop dementia, a typical classic neurologist will give you a couple of medications that we have been using for the last 20 years. They're not very effective. They do not improve memory. They may slow down a little bit the disease, but disease still progresses and patient, unfortunately, will end up in a very bad situation. So as an integrative neurologist, I would like to look at how did they get here? What actually prompted them to develop memory loss? Do they have bad nutrition? Do they have bad sleep? Do they have lifestyle? Do they have toxins that they put in their body on a regular basis, and that's what kills their brain?
Hmm.
So all this is more in integrative approach. And also when we treat patients with dementia, at least in my practice, I combine both.
Mhm.
Because I think that there's no reason not to use modern science to at least hold the disease while we're working on other things to help them to improve their memory and potentially dramatically slow down or potentially reverse their memory loss.
Okay. That's great.
Well, just as an aside, I'm going to give you a little background about my memory problems. About 10 years ago, I was diagnosed with early onset Alzheimer's. However, over these 10 years, I did not regress at all. I stayed the same. So that's when one of the smart neurologists that I was seeing said, you know what, we don't think it's Alzheimer's anymore. So then they sent me to a neuropsychiatrist, and I did a very long test. It was like 3 hours long, if I remember. And she said, what you have is complex PTSD amnesia. And I started going for therapy at a speech therapist.
Okay.
And I did different puzzles, and I still keep my mind active, but I'm not regressing. So
Right. But you also had several strokes.
yeah,
And you're also doing, like physical therapy, you're taking Pilates, you're consulting a nutritionist. So you are kind of covering all these bases.
right.
Like-
But it is amazing that doctors might automatically jump
Mhm.
to the diagnosis of dementia when it's really not warranted. So I love your approach.
And honestly, a lot of patients, even with actually frank dementia,
Mhm.
they still have a reversible part to their dementia
Mhm.
that we can improve and slow down their memory.
Right.
The other thing everybody thinks about memory is basically hard drive. Okay,
Mhm.
in order for you to fill that hard drive with memory, you need to get an input. So your hearing, your attention span, if you are depressed or anxious, you may not pay attention to what's going on. If you have PTSD, you may have inattention to what is being told to you. So it's not getting into that hard drive. So you will not remember. So before starting telling patients, oh, you have dementia and that's all you're going to get, you need to figure out, are there any other components to that memory loss that really contributes to so-called memory loss? But it's not really memory loss, it's lack of memory because it was not formed.
Right.
Okay. All right. Yeah, and that kind of explains why I do have really strong memories of some things that were very emotional. However, I have no memory of everyday items because it really didn't impact me and I didn't take it in.
Or she didn't have her hearing aids in at the time and completely ignored what was being said.
Yes, I did get hearing aids, and that is helping, I'm sure.
Good.
Yeah.
So could you tell us a little bit about your medical practice, sir?
So I actually have a combination practice. So I as a neurologist, as a board-certified neurologist, I just see regular neurology patients in my brick-and-mortar clinic, and that's in Minneapolis. But I also have a integrative neurology clinic that is online, so it's accessible to a lot wider population. Because unfortunately, our insurances do not cover a lot of testing that needs to be done on the integrative medicine level. So those patients really do not benefit from going to insurance-based clinics because their practices, their testing is not going to be covered.
Okay.
So I kind of moved it out to different clinics because in my integrative neurology clinic, I spend way much more time with patients talking about other stuff. Again, lifestyle, nutrition, stress, sleep, all of that. And we do a lot more advanced and sometimes called woo-woo things to help them to improve. We use red lights. We use peptides. I mean, peptides have been used for a very long time, but it's still not a standard of care. Well, besides now everybody is using Ozempic, which is actually great. And talking about Ozempic, just to heads up, there's a new study on Ozempic in diabetic patients that it decreases incidence of Alzheimer's by 40 to 70%.
Wow.
Which is wonderful.
Yeah.
But Ozempic has nothing to do with memory. It has to do with regulation of your appetite, with improving your nutrition, with improving of your insulin resistance. So other things in your body will cause damage in your brain. And that's why my practice is called mind-body neurology, because I cannot get your mind correct without your body being corrected, and vice versa.
Okay. Yeah.
If you have brain that is not working properly, if you're completely stressed out, you're not going to absorb food really well. There are multiple reports on patients when they're stressed out, they die because of the cardiac arrhythmia, or basically heart attack. Okay? It's a brain cause. So we need to make sure that the brain is calm and the body is supplying nutrients to the brain, and then everything will work in symbiosis and will work better.
That makes a lot of sense.
Yes, it's a good overall view of medication or of medicine.
Yes, and what role it plays.
Right.
And actually, Dr. Zubkov, I was wondering, what role does exercise play in cognitive function and recovery after a cerebrovascular accident?
Massive. Well, there is a factor, it's called BDNF, brain-derived neurotrophic factor.
Okay.
Basically, it allows us to form new cells in the brain and allows cells to work better. The one thing that we know about exercise is that it does increase BDNF.
Okay.
So by exercising, we actually improve our brain function. There are peptides that increase BDNF as well, but the cheapest way and the easiest way and probably the healthiest way would be to get exercises.
Okay.
As for recovery after strokes, what I tell my patients is that if you just go to physical therapy three times a week and do half an hour with them, you're likely not going to regain your function. You're not going to get recovery. you need to do those exercises every day, maybe even several times a day, and be as dedicated as possible. And what I tell them that go to physical therapy, get exercises, do them for a week or two at home, go back to physical therapy, brag how well you did, and do exercises so you'll not get bored.
Right.
But
Okay.
daily exercises is the key. People who do daily physical therapy at home, they do way much better than those who just do a couple times a week.
I'm hoping Lita's over there listening and paying attention. And she's really bad.
I am bad at self-regulating my exercise at home. I would much rather go to physical therapy every day than try to do it at home on my own.
Right, covered by insurance. So,
Exactly.
but luckily there are lots of apps out there nowadays that your physical therapist can set you up with, and it'll give you a reminder, and then it plays a video and it walks you through. So it's far more accessible than ever.
All right, I will try. I will try.
In physical therapy is not a rocket science. It's not that hard to do. You just need to know what exercises to do and what sequence and how often you need to do them. So that's all it is.
Yeah, they give me the prescription. It's just a matter of do I take it out of my pocket?
Yes. And hopefully this is the push she needed. I'm hoping.
All right.
And then how important, you were saying nutrition is vital, but how important is nutrition to brain health and function?
Well, when I talk to my patients, I like analogies.
Okay.
So let's say you have a wonderful car that you love.
Okay.
And you drive it and you enjoy it, but you decided not to change your oil. You decided not to change your tires. You put the very low quality gasoline in the car, and the car breaks. And you wonder why. Well, our body is the same thing. If we don't feed our body properly, if we don't take care of our body properly, it will break up, and much faster than usual. I have a lot of patients in the 40s and 50s who lived very hard during their college and early 20s, and now they ain't. And they come in and say, I cannot function on the same level. I cannot exercise. I'm very tired. I have other medical problems, and I'm very fatigued, and I have brain fog. And why is that? I'm just 40. Well, you did not take care of your body for the last 20 years, and now you're paying, your warranty expired. That's what I tell them. And it started breaking down. And it's between 40 and 50. So it depends how hard you go during your... That's why I'm so concerned about our modern generation of students who do a lot of drinking, a lot of drugs in their college. That's kind of a norm, and it should not be a norm. And I think it's a shame to the colleges that they don't teach kids not to take care of it, because in 20, 30 years, when they will develop mild cognitive impairment or dementia, well, it may be that all of it was caused by excessive drinking and not sleeping during the college years.
Right.
Yeah, and I think that your ability, like you were saying, to remember things, I mean, your food is your fuel, and if you for just even improved grades, improved retention during college, if you're eating well and exercising, then that'll be a great benefit to you.
Yeah, I don't know if it's true in Russia, but here in the United States, there's kind of a underlying thought that college kids eat garbage.
But not all do.
They are.
But there's like an underlying...
Right.
And I think that it's probably true for many.
Right. Well, it's the same with everything. I think, like they say, like, if you want to reduce crime, give kids at a very young age nutritious meals and get lead out of their water. We have lead pipes in a lot of cities. So if you have less lead in the water, or preferably very little lead in the water, and you give them nutritious food when they're at school at least, then you're going to have better brain development at a young age as well, which is what I think we wish for everyone.
Right.
100%. And also education. I mean, it's profoundly important and profoundly concerning to me that how little education patients have. Just a little example. So every time when they come to my clinic, I ask them, how much water do you drink?
Mhm.
Simple question.
Mhm.
Not a lot of providers will ask that, but I asked them. And said, well, I don't drink maybe 1 or 2 cups, but I eat a little white, but I drink a lot of Crystal Light.
Mm.
Because, or, well, did you ever look at the Crystal Light contents, what it has in it? It has a bunch of chemicals. It has aspartame, which is a artificial sweetener, and we'll talk about it in a second. And it has maltodextrin, which is basically sugar. So they think that they drink a sugar-free drink, but it has sugar in it.
Right.
But aspartame is literally, it's a poison to our body. And aspartame, when our mouth feels that something sweet is coming, it starts processing preparing all the ferments and all the hormones to start processing that sugar. And then it comes to your stomach and there's nothing there.
Mhm.
All these hormones floating around and doing some other bad stuff and causing all insulin resistance in patients instead of just really causing what they're supposed to do, push the sugar in the cells. Then eventually, patients will develop diabetes and prediabetes and diabetes. And when that happens, everything just falls off the shelves.
Right. Excuse me, but what is one thing that you wish everybody knew about brain health?
That alcohol is a poison.
Okay.
Seriously, it's a neurotoxin. It's a well-known neurotoxin. Again, we take care of our cars, but we don't take care of our body. We not going to think about doing anything bad to our car because we need to drive it. But yet we put really bad alcohol and tobacco in our body and expect our body to work properly. This is number one. I mean, obviously, nutrition, sleep, lifestyles, all of this is profoundly important.
Mm-hmm.
But if one thing that needs to change is just remove alcohol consumption, remove tobacco. When patients come to me with a stroke and they're smokers, I tell them that I cannot prevent your future strokes until you'll quit smoking.
Mm-hmm.
I have seen so many patients who come to me with dementia who had heavy alcohol intake before, and maybe they even quit now, maybe in remission, but they have been alcoholics for 10, 20 years. And then they ask me how they can get their brain back. Yeah. And you can't. You can't. It's basically damaged.
Yeah.
So the sooner you make those
Changes.
Positive lifestyle changes, the better.
Yeah, I know that, you stop smoking and then 10 years later, your lungs are starting to clear up, but
right after day one, they're better.
But not your neurons.
Yeah.
It takes time.
Yeah.
And, Alzheimer's takes about 20 to 30 years to develop in the body before it will become clinical.
Okay.
So this window that we need to address and try to get healthy lifestyles in the patients, healthy nutrition during those between 40 and 60, that's the most critical time if you want to prevent dementia.
Okay.
So that's when
every dementia. I mean,
right.
Somebody could say, well, I was eating so healthy and I developed dementia. Well, there are other things that potentially can cause that. But in a lot of patients, that's one of the reasons for it.
Right. And another reason to start as young as possible. And if it isn't until university, until that age, but as young as possible, teaching people coping skills and how to deal with stress and alternatives to dealing with stress, because it seems like a lot of us turn to food, drugs, or alcohol as a coping mechanism, and it isn't a positive coping mechanism, and it can lead to recidivism, and you're constantly seeking that out. So the sooner you learn how to cope, the better the outcome will be. And that's great. So I can see how integrative therapy and integrative neurology can help the whole body, and especially the brain is the focus, but your whole body's going to benefit from that.
Mm-hmm.
That's great.
Mm-hmm.
But stress is profoundly important. And when you're stressed out constantly, your cortisol goes up. We know from the science that excessive cortisol atrophies our brain memory centers. So if you're constantly stressed out, eventually you will develop memory loss just because of that atrophy.
Okay.
And again, I've seen multiple high-level executives who were high performers meaning that they were stressed out,
Mm-hmm.
and now they're developing pretty significant memory loss because they kind of really poison their body with that excessive cortisol. But yeah, absolutely, coping mechanisms are profoundly important. Meditation, guided meditations, just trying to find something else that will relax you. Proper sleep will also allow you to cope with your stress. All of this is profoundly important. No question about it.
Okay.
And if a patient is coming to you, you have a new patient, what can they do to facilitate their care? Does it help to bring in records? Does it help to bring to, like we use technology to track our sleeping and nutrition. And nowadays you can even have over-the-counter like glucose monitors. Does all that information help? What is the best thing a new
We use it
patient can
all.
do? Okay.
We use it all.
Okay.
So as a neurologist, again, as a classically trained neurologist,
Mm-hmm.
I want to make sure that patient does not have a big boo-boo in the brain.
Mm-hmm.
I want to make sure they did not have a stroke, they did not have bleeding, they don't have a brain tumor. So I rule out bad stuff up front.
Okay.
And obviously, if they've done it with somebody else, great. So that, and then if that is all clear, then we'll start looking at the more function of the brain and really supporting the brain from nutrition standpoint, because we know that whatever is going on is not going to kill you right away. We have time to get you better regulated.
Okay.
I just went off on a tangent thinking, well, I mean, it's same tangent.
Was it because of all the Gatorade you're over there drinking instead of water?
No.
Okay.
I was thinking about the high cortisol, as you were saying, and the fact that there are so many young people today in our country that are going to school every day, thinking that in the back of their mind that they are at risk of maybe getting shot.
Okay, yeah.
I'm just saying.
Yeah. So
they are living with high cortisol every day.
Yeah, it's sad.
Look,
I mean, something's got to happen.
Okay.
All right. Anyway,
get off your soapbox.
Okay, soapbox is gone.
Okay, thank you.
Doctor, what advice do you have for current or prospective medical students?
be open.
Be open?
Be open-minded.
Okay.
Again, medical school now teaches, again, pathology, medications. That's all it is. They don't really teach nutrition. They don't really teach that much about lifestyle and stress. Just be open, listen to patients. They actually will teach you what happens. I have a lot of patients that come to me with migraines and say, well, I start eating better and my migraines went away. Well, boom. Maybe you don't need medications. Maybe you just need to eat properly and maybe drink properly. So your patients will teach you if you open to that. I have had so many patients that come to me, work with me, get better, then go to their primary doctor and said, nah, you just got better because you got better. Really? I just spent half a year trying to work on your nutrition and lifestyle.
Right.
Your numbers went down, and it just happened.
It happened through a lot of work, a lot of effort, a lot of time.
Right.
Exactly.
And how do you personally maintain a good work-life balance?
With big effort.
Okay.
It's not again, I'm trying to make sure that I'm reading right, that I'm sleeping right, that I'm not poisoning myself. I'm not doing anything that will endanger my life. And I'm trying to regulate my hours. I mean, in the beginning, like every stroke physician, and especially when I was doing neurocritical care, I was not sleeping. I was on call all the time. And that caught up with me. And at some point, I just said, well, I'm not going to do that anymore because it's not going to be good for me. And, everybody thinks, well, the health is expensive, but my sickness, it is way much more expensive. So, and a lot of people say, well, I cannot afford this lab or that lab. But then, yes, you can afford being sick in a hospital and being in a nursing home. So you have to make your priorities. And my priority is my health. And also teaching my patients how to become healthy. We all talk about lifespans. So living longer. What does it mean? I have 75-year-olds who are living in a nursing home in a wheelchair, going under themselves and not knowing where they are. They will still live for another 10 years.
Mm-hmm.
Not the lives that I want for my patients. I have 92-year-old who is bouldering on his Jeep and enjoying his life.
Mm-hmm.
That is the cool stuff. That is the health span.
Right.
And that's
right.
what I promote in my patients, is to get them healthy for as long as they can. I mean, we cannot control everything by
Mm-hmm.
any means. I'm not pretending that I'm a God that they can fix everything. No. But at least I can improve and give you higher chances of being healthy for longer, and you will enjoy your life longer. And that's all it's about.
Right. Yeah, I can
Good
see
answer.
that. Yeah. And doctor, what do you do to help reduce stress?
Meditation is number one.
Okay.
Proper sleep is number two. Proper sleep hygiene
Mm-hmm.
is also very important. So what do you do before sleep to get you to sleep better? And again, there are a lot of other techniques that I teach my patients, how to improve their stress and how to just how to make sure that they will not be stressed out. Breathing alone will help you to de-stress yourself. If you feel stressed, go in a corner and just breathe for 5 minutes properly.
Yeah. Lita just started taking physical therapy
To learn how to
learn
breathe.
how to breathe. So
Well,
she is
I
learning.
mean, I got to 70. I got to 70
That's
years
what she
old,
keeps
but,
telling us,
but
but
I don't know how to breathe.
she is learning how to breathe, and that's one of the goals of her physical therapy.
Yep.
And it's very exciting.
Do you know what happens when patients are anxious?
They stop breathing.
No.
They hold it. What?
They start breathing faster.
Mhm.
Oh.
If they will just slow down their breathing, their body will relax and their anxiety will get better.
Okay.
Mhm.
Okay. Maybe that's part of my.
That's probably part of it.
I
And-
was told that I was not breathing, and I was,
Well, you
checking
may
my-
be very shallowly,
Right,
so we
and
solve the problem.
Right.
Yeah, she's learning all the different types of breathing and different breathing techniques. And
Wonderful.
yes,
Perfect.
we're very excited for her on that one. Yes.
I did have a question. Boxing. Boxing for Parkinson's. I don't
Yes.
know what part of the boxing helps Parkinson's, but would it help any brain problem?
So, boxing with the bag, yes, maybe. Boxing with the partner who will hit you in the head, no.
Okay.
Yeah, I could
So,
see a neurologist would be against that type of
Yes,
physical contact
Right.
boxing.
Right.
I think for Parkinson's it is more just like
Balance?
shadow boxing. You're not hitting a person, I don't believe.
No, I know, but
Okay.
maybe they do that to get their balance back.
And also it's a breathing technique
Okay.
involved.
When you do boxing, you have to be balanced. You have to be coordinating.
Mhm.
So your brain has to work hard to punch properly,
Okay.
because otherwise people will just flail around.
Sure.
So to do it properly, your brain has to work much harder.
Okay.
So brain needs exercise as much as our body. That's why, there are a lot of programs that do that, but even the complicated, so Tai Chi is profoundly effective and profoundly popular in China, especially for people who are aging. It is extremely complex movements. You have to remember how to flow properly. And again, your brain has to coordinate all these movements in the different directions. So that allows your brain to work harder and work better.
Yep.
So
I like
Tai
that.
Chi
I like that
Right.
answer.
movements, that sort of is it's a moving meditation essentially.
Mhm.
So Qigong is another technique that also will allow patients to move and breathe properly at the same time by decreasing their stress.
Okay.
Got it. Excellent.
I think we'll add that to your routine.
Yes, I
Sign you
have,
up.
I have so many thoughts about this.
Yeah.
Well, thank you so much for taking the time to speak with us today. Can you share with our listeners any of your social media accounts if they wanted to
or how
follow
can
you?
they learn
Yeah.
more about you, and how can they if it's a new patient, how can they find your practice?
Okay, that too.
So I have two websites. One is zubkovmd.com and another one is Mind Body Neurology. They're sister websites, so they're very similar in appearance. On both of them, you have links to schedule your appointment. So it will go to my calendar and you'll be able to jump on that. I do a lot of short videos on TikTok. It's at Zubkov MD. So I've been doing that for the last 3-4 years. So I think there are over 700 videos on different aspects of integrative neurology. So you certainly can learn a lot by doing that. If you need help on more individualized, personalized basis, I'll be delighted to help you.
Excellent.
Wonderful.
We appreciate that very much.
If you have any questions or comments related to today's show, you can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram. And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you've heard of this podcast.
Till next week.